examination of skeletal remains falls under the autopsy category for simple reason that we do thorough, detailed examination on every single bone that comes, looking for trauma, looking for tool marks, describing artifacts and such. So it is a time-consuming and it's a thorough procedure, which in the end results in a complete report. Sometimes followed by ancillary studies, toxicology, DNA studies, sometimes biochemical studies, whether it's a bone or bone marrow. So because of the complexity of the case, we call it an autopsy. Now, in the group of the patients or victims who are recently deceased, then what's going to be autopsy, what's going to be exam, depends completely on the investigative information and the background, like a medical history and stuff like that. So that's going to be the determining factor which way we go. But regardless whether we do autopsy or examination or exam, postmortem exam, we always draw fluids for toxicology. So essentially almost everybody gets toxicologic examination, thorough external examination, and then the difference in the end is whether we proceed do autopsy, such as essentially it's a kind of thorough, extensive surgical procedure in a sense, because we look at every single organ system in the body. So we can get extensive information. Number one is going to be identification of the individual. That's going to be always the first concern, and we can definitely obtain that looking at the skeletal remains. The presence of the disease, presence of the old fractures, new fractures, which would indicate new trauma, and of course, then dental examination that you already discussed as far as identifying the individual. So yes, we can really gain a lot of information by analyzing a skeleton, yes.